Mr. Flynn, my name's Amanda Flynn. I'm with Maryville University. We're going to do a full head-to-toe assessment on you today for adult health assessment, nursing 612.
Okay.
Okay. So we would start with having the patient go ahead and empty their bladder, change into comfortable clothes, preferably a gown. We would do height, weight, vital signs including O2 saturation, blood pressure, heart rate. We would also do a Snell chart test for vision, which is for distant vision, and a Romberg test for far vision. Those will check for optic nerve, which is cranial nerve number 2. So we would go ahead and we would start with inspecting the patient's skin and head. Hair is equally distributed, eyes are normally set, ears are normally set, nose is midline, there's no facial deformities, looks like good skin turgor, no lesions. I would go ahead and palpate the skull. Patient is normal cephalic. I don't feel any lumps or lesions. Sir, could you go ahead and open and close your mouth? We're checking for the TMJ joint, making sure it's not having issues. We would go ahead and take a look at the patient's eyes. Patient's sclera is nice and white. Look up for me. Conjunctiva is pink. Lacrimal ducts are intact. Eyebrows are within normal distribution. I will go ahead and check the patient's ears. We would go ahead and move on to the Weber and the Rhines test. This is a test checking for bone versus air conduction. Sir, I'm going to go ahead and hit this tuning fork and place it on the top of your head, and please let me know that if you can hear it in both ears.
Yes.
We're going to go ahead and put this on the mastoid bone after we strike it. Once you do not hear it anymore, please let me know.
I do not hear it. I hear it. Not anymore.
We would check both sides on that. Sir, I need you to go ahead and take a look at the across the room. Focus on one point, cover one eye, please. Okay, opposite, please. Okay. Sir, I will go ahead and have you watch this pin with your eyes only. We are checking for the 6 cardinal gazes of vision. We would check for the patient's ability for normal conversion of the pupils, for direct or indirect light. Indirect, direct, indirect, direct. Perfect. You could go ahead and cover one eye, sir. We're going to check for vision. You see it?
Yeah.
Cover the other eye, sir.
Yes.
Peripheral vision is important to be checked in patients. We will go ahead and check the patient's ears as well using an otoscope. I will go ahead and palpate the auricula. There's no lumps or lesions. Tympanic membrane is pink. It's pearly gray with a conal light at 5 o'clock on the right. Ear canal is intact with no debris. Ear canal is intact, no debris, and the tympanic membrane has no scarring with a cone of light at 7 o'clock in the left ear. Sir, I need you to go ahead and stick your tongue out for me. Go ahead and grimace, smile, squeak your eyes shut. Okay. Go ahead and move your head back and forth. Shrug your shoulders up. Okay. So we're checking for cranial nerve number 3 with the cardinal gaze vision, number 8 for the Weber and Rhines test, which we just conducted. And with a shrug of the shoulders, that's the accessory muscle or cranial nerve number 11. We're going to go ahead and check the patient's bony structures of the face by palpating the facial bones. There's no tenderness. I don't feel any lumps or lesions. We would go ahead and check for the patient's lymph nodes at this time as well. We're going to check the preauricular, the postauricular, the tonsillar, the submandibular, the submental, the cervical chain, the deep cervical chain, the supraclavicular, and the axillary. With the pin light, you will need to assess the patient's nose that terminates along with hair distribution, septum. Patient's septum is straight, mucous membranes intact, pink, hair is normal distribution. And the terminates are within normal. The patient's eyelashes were intact as well. When we go ahead and move to the nose and the throat of the patient, you go ahead and have them say ah.
Ah.
We are checking for cranial nerve number 10, which is the vagus nerve. You open your mouth, please. Uvula, soft palate, hard palate are all intact. Tonsils are 1+. Tongue is midline. Teeth are in good position. Mucous membranes are nice and pink and moist. Lips are pink and moist. There's no odor to his breath either. We would go ahead and move on to inspect the neck. With the neck, we are inspecting the patient's carotid artery, the patient's trachea, and the thyroid. Obviously nice and smooth. There's no lumps or lesions. I don't feel anything. I would go ahead and have the patient swallow. Checking for the thyroid to move easily up and down with that motion. We can go ahead and palpate the left carotid, the right carotid, and then also the trachea and the thyroid. Using the bell of the stethoscope, we would go ahead and listen to the patient's carotid artery. Take a deep breath, sir, and just hold it for me. And the patient's thyroid, you can breathe, sir. Perfect. While I'm here, I'm going to go ahead and check his strength as well. Sir, go ahead and push your head against my hand. Perfect. Perfect. Yeah. Perfect. Front. Perfect. We're going to go ahead and inspect the upper extremities. The hair is normally distributed, nice and warm. I would go ahead and check the patient's radial pulses bilaterally. They are 2+. The patient's brachial arteries, which are 2+. Sir, if you could go ahead and put your arms out, we're checking for strength. Don't let me push down, sir. Great. Up. Perfect. Hands forward. Go ahead and squeeze my hands. Perfect. Pull towards you and push away. Perfect. We're going to go ahead and listen to the patient's chest now. What I'm listening for is, first I'm going to go ahead and listen for breath sounds, heart sounds. I'll go ahead and palpate and percuss. In a symmetrical manner, moving from one side to the other, I will listen to the patient's lung sounds, not forgetting to have the patient raise his hands over his head to listen laterally. You put your hands down, sir. I'm going to go ahead and listen at this time to his heart sounds. We're going to listen to his aortic, his pulmonic, Erb's point, tricuspid, and mitral. I'm going to lightly go ahead and just palpate the chest, the precordia. feeling for any thrills, heaves, or lifts, and identifying the pulse point. I'm going to go ahead and percuss his chest. Noting any changes in sounds. I'll go ahead and move to the posterior portion of the patient. Percussing. Go ahead and feel for any kind of deformities. Go ahead and the coastal vertebral angle on each side of the kidneys. Check for any tenderness. There's none noted. We're going to go ahead and check for diaphragmatic excursions, or take a big deep breath in and out. Perfect. Checking for where the diaphragm is, marking it, coming back up. In normal limits. We'll go ahead and have the patient go ahead and lay down. We're going to check his abdomen at this time. Take a look, and we're going to look at the contour of the patient's abdomen and chest. I don't see any pulsations. I don't see any heaves or lifts, any abnormalities. We're going to go ahead and just do a general inspection. You want to go ahead and listen to your bowel sounds for the first time versus palpating in all 4 quadrants. You may need to listen for 1 to 2 minutes. I'm going to lightly palpate. I'm going to percuss for liver border on the right. Spleen on the left. I'm going to go ahead and try to feel for a kidney on the right. One on the left. Go ahead and try to palpate for the aorta. I don't feel any pulsation. I will go ahead and listen. The aorta, each renal, iliac, femoral, no buries were noted. Some people have patients sit up for this. I'm going to go ahead and have him still laying down. I'm going to check for on his lower extremities. The hair distribution is normal and equal. Good musculature. Checking for the popliteal pulses, which are 2+. Posterior tib, 2+. Pedal, 2+. I'm going to go ahead and check sensation at this time. Sir, I want you to close your eyes.
Yes. 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 Yes.
Please tell me if this is dull or sharp.
Dull. Sharp. 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 Dull. Sharp. Dull.
We'll go ahead and have the patient sit up, and we're going to check for his reflexes. Achilles, bilaterally. Brachial. Cradle. Radial? Radial. Sir, if I could have you stand up, sir, we're going to check your spine. Taking a look at the patient's spine, check cervical, run your hands down the patient's back, checking for any kind of protrusions to thoracic, to lumbar. Sir, if I could have you bend forward, please. Checking for kyphosis or any scoliosis, which is none is noted. And that concludes my assessment from head to toe for Amanda Flynn, Adult Health Assessment, Fall 2016.